Welcome to the deep dive. Today we're getting practical, really focusing on something key for medical professionals, especially if you've got the MSRA coming up.
Yeah, we're looking at the DVLA guidance, specifically for cardiovascular conditions and driving.
Exactly. It can feel a bit complex, so our mission today is to pull out the really crucial bits, the stuff you absolutely need to know, for exams and practice.
Let's make it clear and hopefully memorable. Where should we start? Hypertension seems like a common one.
Good shout, hypertension. So the general rule is most people can drive.
Right, unless the treatment causes severe side effects, drowsiness, that kind of thing.
But there's a big but for Group 2 drivers, your HGV bus driver.
Much stricter.
Yeah. If their blood pressure is consistently 180 over 100 or more, well, that's a disqualification.
So 180 over 100, that's the magic number for Group 2. Maybe think like double trouble, 180, 100 for the heavy haulers.
I like that. Okay, what about procedures, say an elective angioplasty?
Planned angioplasty. That's quite simple. 1 week off driving.
1 week, nice and short. And CABG, coronary artery bypass.
CG takes a bit longer. It's 4 weeks off the road for that one.
4 weeks. Okay, so 4 for bypass.
Exactly. Helps it stick. Now, acute coronary syndrome, ACS, the standard is also 4 weeks off.
4 weeks. Again, like CABG.
Yes, but there's an important exception. If the ACS was treated with angioplasty.
Like the elective one.
Sort of, yeah. If angioplasty was the fix, it drops down to just 1 week off driving.
Okay, so the intervention gets you back quicker. That makes sense.
Definitely. What about angina?
Angina. This feels like a really critical one for safety.
It is. The rule is absolutely clear. If you get angina symptoms at rest, or crucially, while you're actually driving.
You have to stop driving immediately.
Immediately. No ifs, no buts. You inform the DVLA and stop driving until it's sorted.
Non-negotiable. Okay. Pacemakers.
Pacemaker insertion. Back to the simpler ones, relatively speaking. 1 week off driving.
1 week. Like the angioplasty.
Similar time frame. Now, ICDs, implantable cardioverter defibrillators, are a bit more complex.
Right, because they're often for more serious rhythm problems.
Precisely. If someone gets an ICD because they had a sustained ventricular arrhythmia, a life-threatening one, they're looking at 6 months off driving.
6 months? That's a significant period.
It reflects the underlying risk. But if the ICD is put in prophylactically...
Meaning just in case, as prevention.
Yeah, high risk. But they haven't actually had the dangerous arrhythmia yet. In that case, it's 1 month off driving for a Group 1 license.
Only 1 month. That's quite a difference.
It is. But, and this is vital, for Group 2 drivers, a prophylactic ICD means a permanent ban from driving Group 2 vehicles.
Wow, okay. Permanent bar for Group 2. That's huge.
Definitely a key distinction. What about successful catheter ablation for an arrhythmia?
Good question. If it works.
If it's successful, the downtime is minimal. Usually just 2 days off driving.
2 days. That's surprisingly short.
Assumes everything went well, of course. Okay, shifting gears slightly. Aortic aneurysms.
Right. Size matters here, doesn't it?
It does. There are 2 key thresholds. Once an aneurysm reaches 6 centimeters.
6. Okay.
The DVLA needs to be notified, and the patient needs an annual review.
Notification at 6 centimeters. And when are they actually disqualified?
Disqualification happens if it reaches 6.5 centimeters.
Only half a centimeter difference. So 6 centimeters is notify and review, 6.5 centimeters is stop driving.
You got it. That small margin is important to remember.
Okay, nearly there. What about a heart transplant?
Major surgery, obviously. The driving restriction is 6 weeks off.
6 weeks. Longer recovery. Do they need to tell the DVLA?
Interestingly, no specific DVLA notification is needed just for the transplant itself, provided the person is otherwise medically fit to drive after those 6 weeks.
Right, assuming recovery goes well and they meet the general fitness standards.
Exactly. So I think that covers the main cardiovascular points we wanted to hit.
Yeah, that's a really helpful run through. The key thing, especially for anyone dealing with patients or, revising for exams like the MSRA, is knowing these specific timeframes and thresholds.
And remembering the stricter rules generally apply for Group 2 drivers. Public safety is paramount there.
Absolutely. So if this deep dive was useful for your MSRA prep, don't forget to check out passthemsra.com.
And also free-msra.com for more resources and practice questions.
Definitely worth a look. It really boils down to that balance, doesn't it? Keeping people safe on the roads while also considering an individual's mobility and independence.
It's a complex balance, and understanding these guidelines is the first step for us as clinicians to help patients navigate it.